So I'm Theresa Mallick Searle. I'm a nurse practitioner in the Division of Pain Medicine at Stanford Healthcare in Redwood City, California. I do a combination of acute and chronic pain management. I've been doing pain management for about 25 years now. And I've been a speaker and a contributor at PAINWeek for about 7 or 8 years. So this year I'm most excited about the APP track. Lectures given by advanced practice providers for advanced practice providers. And it's going to be integrated throughout the whole week. Some of the lectures will include Zora Suhaini, which is going to be talking about interventional pain management. We're having a lecture that's going to be co-presented by myself and my colleague Anuj Agarwal, and we're going to be talking about long COVID pain and really what that means now, almost 5 years into the process and where patients are at and what are some of the recommendations. And I'm really excited about a panel that we're going to have on legal aspects of pain. So we'll talk about what it means, not only the legality that comes with practicing pain management, but what it means specifically for advanced practice providers. Just give them the tools to be able to practice safely and to do good patient care.